Hey everyone, Crystal here in the AAFE Training Center, and today I am treating a patient with hyperhidrosis with neurotoxin. So we can use neurotoxin all over the body where people experience excessive sweating to kind of help paralyze that sweat gland and decrease the production of sweat. So one of the obvious most common areas is the underarms. So typically this treatment takes about 5 minutes, if that, per side. But what's nice is that the result typically kicks in very quickly. Usually within a couple days or so, you'll really start to notice a decrease in sweat production. And then most patients get closer to that 5 to 6 month mark with this dosing. Some patients need it every 3 months, especially if they just kind of start out. Their body will have to kind of get used to it after a few treatments. They may not need as much. But most of my patients that I treat for hyperhidrosis in the underarm, they typically get like 5 to 6 months out of it. So it's really nice. I use Xeomin in this area. You can use any neurotoxin that you have, whether it's Botox, Dysport, whatever you may have in your office. And you can see just how superficial I'm keeping these injections. So unlike when we do neurotoxin in the face, where we get a little bit deeper because we want to get into the muscle that we're treating, in this instance, we're just trying to stay in that superficial area where the sweat gland lives. So if you go too deep, you're not going to be as effective with your treatment as you would be if you keep it more superficial. So I'm leaving little, what I would call like wheels, almost look like little TB tests right under the skin. And I'm just evenly spreading the injections across the entire area. And I'm looking closely, kind of seeing like where I see hair follicles, because where you see hair, that's where a sweat gland is going to be. So trying to just stay within that area as best as I can. And then I will do the same exact thing on the other side. Just clean with alcohol. And that's it. She's good to go for the next 5 to 6 months. Thank you so much for watching, everyone. I'll see you in the next one.